Earlier today, a rupees 1.7 lakh crore relief package was announced by the Narendra Modi government, primarily for daily wage laborers, for farmers. This includes insurance for frontline workers, 50 lakh insurance for doctors, for nurses, paramedics, also 5 kilos wheat or rice free for 3 months to 80 crore ration card holders, an additional 1 kilo of pulses for every ration card, a 2,000 rupee payment, upfront payment to 8.7 crore farmers, 1,000 for senior citizens, 3 months, 500 per month for women who hold Jan Dhan account holders, and 8.3 crore BPL families to get free cylinders for 3 months. And there will be other benefits including collateral-free loans and benefits for low-income groups and those working in the informal sector. The announcements, though, couldn't have come a moment too soon, because the fact is, with an unprecedented complete national lockdown in place, it's not just the economy that's taking a hit, but at the individual level, it's the daily wage earner who's suffering the most. With no security and no insurance umbrella, it's these migrant workers who are simply at the moment on the move.
The lockdown is certain to have a massive economic impact, putting millions of jobs at risk. Casual laborer is a person engaged, not in a fixed, but in a casual manner, in another person's enterprise, and in return is paid daily or periodically. That includes cleaners, household workers, and construction workers. Prakash, who worked with a cloth trader in Ahmedabad, is just one of these casual workers walking back home from Ahmedabad to Rajasthan.
अब यहाँ पे हम जो अकेले रहते हैं, इसलिए हमारा परिवार वालों का भी एक मन की एक आशंका रहती है, बोले बच्चा कहाँ रहता है, क्या रहता है, कोई क्या करता है, खाता है, पीता है. जैसे अभी मार्केट डाउन हो गया, इसलिए हमारे घर वालों को भी थोड़ा डर का संकोच मन के अंदर पैदा हो गया.
कितने किलोमीटर का सफर आप लोग तय करके जाएंगे?
490 किलोमीटर का सफर है, पैदल चल के जाएंगे.
The situation is no different in the city of Nawabs. The daily wages here have no food to cook and no money to buy anything.
तुमने क्या खाया? कुछ नहीं खाया. क्यों? खाना नहीं है घर में? बनाया नहीं? क्यों नहीं बनाया?
नहीं रहा.
घर में खाना नहीं था. अच्छा, तुमने खाया?
नहीं.
क्यों?
घर में खाना नहीं था.
बीमारी से तो कम मरी है और भूखे से तो ज्यादा मर गई है.
In the financial capital of the country too, there are many who are left with no work and are now dependent on others for help.
अभी फिलहाल तो काम नहीं है, कुछ ना कुछ करते हैं हम लोग. ऐसे तो होटल में भी हम लोग को दे के कितना दिन ऐसे दे सकते हैं, और मांग के भी कितना दिन ऐसे मांग सकते हैं. और कल हम लोगों ने सुना न्यूज़ में कि वो नाके में लेबर लोग को कुछ हेल्प करेंगे बोलकर मैंने सुना ऐसे न्यूज़ में. लेकिन अभी फ़िलहाल अभी कुछ नहीं है. इधर खड़े रहने के लिए भी मुश्किल है. पुलिस लोग आते हैं, लाठीचार्ज करके चला जाते हैं. वही प्रॉब्लम है.
तो आपको अभी आप लोग खाना कहाँ से अरेंज कर रहे हैं? खाना कैसे मिल रहा है?
खाना हमारे को कल इतने हमारे को चावल दिया था, वही खिचड़ी भात बना रहा है. अभी फ़िलहाल थोड़ा चावल बचाया था, उसमें से खिचड़ी भात करके हम लोग एडजस्ट करके ले रहे. और अब हमारे को जो बाजू वाले मैडम है, वो भी हमारे को आज के दिन हेल्प कर रही है शाम को. तो बाकी दिन और अभी 14 अप्रैल तक कैसे दिन निकालने का है वो थोड़ा सोचना पड़ेगा.
In Delhi's Yamuna Pushta area, people haven't had a meal for the last 2 days. Many of them are daily wage workers who work at hotels or at wholesale markets.
जिसने भाई बंदे हमारे खड़े हैं, उनको बोले केजरी सरकार पर वो मोदी को हमें सबको लाए और लाइन से गोली मार दे, कहानी खत्म है.
पहले तो अपना कमाते थे, खाते थे, अब बंद हो गया तो कहाँ से खाएंगे? इसलिए यहाँ खाते हैं, थोड़ा बहुत सो जाते हैं यहाँ पटरी पे.
The homeless in the city and the people who are the most vulnerable are those who are daily wage laborers and depend on their daily earnings to eat on that day. For the last 3 days, they have been getting food from the government and via charities at the night shelters. With cameraman Nasir, this is Anisha Mathur for India Today.
The big question right at the top: will this 1.7 lakh crore big bonanza that the government calls it mitigate the misery of the poor? This financial package for small firms next Is India staring at a bigger crisis in that sense than 2008? What are the real challenges that lie ahead in addressing the needs of migrant labor, particularly those who are moving from urban to rural areas? Some of the questions that we'll raise tonight. Sachin Pilot, Deputy Chief Minister Rajasthan, is with us. Sanjeev Sanyal is Principal Economic Advisor, Government of India. But let me come to you, Mr. Pilot, who are joining us on Skype, because yours is one of those states, and we showed one instance, a number of workers live outside Rajasthan, residents of Rajasthan, travel for work and are walking 480 kilometers to reach their villages. How are you going to track them and ensure that they get these benefits that this relief package has promised?
The first thing is that people who are trying to come back to the state, we have to be very careful, because just at the border of Gujarat and Rajasthan, there were upwards of 20,000 people who had come into the state, and we are having to screen each and every individual and then do GIS mapping so that we know where their whereabouts are. And that will take time, at least till tomorrow evening. The first is to identify who those people are. And I've said this, wherever people are, we're trying to make arrangements for people not to travel. This is a national lockdown. But people are, some of them don't have homes to live in and food to eat. Those are the ones we are actually trying to locate through our district officials. And the second aspect is then to make sure that the appropriate help reaches the right individual. The administration is fully geared up in the state. In fact, we were the first ones to have a lockdown in Rajasthan, but that problem still remains. I don't want to mitigate the problem by saying that it doesn't exist. Of course it does, but we are all hands on board. We are taking every stakeholder on board, government, NGOs, self-help groups, individuals. I think it's a societal movement, and we must understand that this is the most crucial stage, it's stage 3.
But they need cash in hand. You know, if I may stop you, what they really need at the moment is cash in hand. There is no economic activity. The government has said that Manrega workers, for example, who are getting 180 rupees per day will now get 201 rupees, about a 20 rupee increase. Now, the fact is there is no Manrega work. There is no construction work. So they need cash in hand. Will there be direct cash transfers for those who need it most?
Yes, the two things. First, Rajdeep, is that Narega, we have a provision within Narega that if you work on your own farmland, then you also qualify to get payments for Narega. And 80% of people who take part in Narega activities actually work on their own land. So that hasn't stopped completely. There's been a climb down from the numbers, but the Narega payments have to be made very timely, and those accounts we already have. Then you have Jan Dhan accounts. So there is cash transfer happening, but more important than the cash really is the availability of food. So we're making food package, whether it's atta, dal, chini, salt, all that stuff in a pack, and it's being distributed. So I think the supply chain of the food and perishable items is far more important than even cash. Of course, you need money to buy essentials and medicines, etc. But food items availability is perhaps the most important part. I think we're quite well placed to be able to take that on. It's a challenge, certainly, but with the support of everybody, I think we will see this through. But let me reiterate, the idea is not anything else but to contain the spread. God forbid the spread goes into a community stage, then we have a much larger problem, and India's population is so much that we will be at our wits' end to figure out how to tackle it then.
You know, it's interesting you're saying that, because some of the cases that we are getting at the moment are from Bhilwara in Rajasthan, where someone came from Saudi Arabia through contact testing. It's now being seen that he has infected more than a dozen people in Bhilwara itself. Is your district level hospital system equipped to tackle a potential outbreak in a place like Bhilwara, Mr. Pilot?
So we are prepping up approximately 100,000 beds, extra beds. There's isolation wards in every district headquarter. Even in Bhilwara, 2,000 more beds have been made available. And the only silver lining that I can share with you on this program is that the Bhilwara incident actually can be tracked back to people with a travel history. So it's people who've traveled overseas and have then contacted the disease. Yes. So it's not a community spread. It's still worrisome. We're trying to locate all the people that the doctor may have met. Perhaps he had a house guest who came from the Middle East, and that's how he contracted the disease. One person died, but the fatality occurred on an individual who was already quite sick. He was in coma. He had a kidney failure. He was quite an unwell patient from the beginning. So he passed away, unfortunately. So we're still trying to limit the spread. And I keep saying this, that the only way out of this is prevention. It's the small things that we do in our daily lives that can actually save the nation from a catastrophe.
Let me just come to you, Mr. Sanjeev Sanyal, Principal Economic Advisor. This 1.7 lakh crore plan announced by the government. Now, many other governments have gone much further. The United States, a $2 trillion revival plan. Do you think much more will be needed to be done? Can we expect that the government will come with more financial help in the days and weeks to come to those who are hit most by COVID-19?
Other governments have taken a somewhat different approach. Many of them have gone ahead and announced very large packages. We have taken a somewhat different approach, which is that we have gone step by step and at every stage laid out according as things evolve. So the first and most important thing that we needed to take care of was obviously the health aspects of the pandemic. So consequently, as you saw, first with the Janta curfew, and then we also now have put in place a 21-day lock-in period, lockdown. Now, what we will now do is, after that, we saw that since this happened to be a point where it just happened to be close to March 31st, end of the financial year, we recognized that there were deadlines, etc., that needed to be taken care of. So again, you may have seen Finance Minister came for a press meet. She announced that all of these deadlines have been pushed back. Now, most of them will be in and around 30th of June. Then we recognize that the next group of people who we need to take care of is the very vulnerable, the bottom of the pyramid, who have suddenly found themselves in a position of difficulty as a result of this lockdown. And as a result, today, what we tried to do was to target this group, make sure that they have supply of food, which is physically be given to them, some cash in the pocket provided through Jan Dhan and other means, and of course cooking gas so that they can cook their food. And the idea here is that at every step we come in and a calibrated measure is taken so that we can deal with the problem as it comes along.
But Mr. Sanyal, there are those like former Finance Minister Chidambaram who are calling it a very modest package, who are saying that the difficulty is your package, the government's package is not putting enough cash in the pockets of the poor. I mentioned how Manrega, for example, many of Manrega workers don't have any work at the moment. So how do they get cash? Is the real challenge to put more cash in the pocket of the poor at a time like this?
Well, obviously, I can't comment on a political response. All I will say is we recognize that there are many economic challenges for the wider economy. Clearly, there are issues that the middle class will deal with, the industry, particularly MSME segment, will have to deal with, and so on and so forth. So we fully appreciate that, but you have to see that our approach has been to go about this step by step. This is, you may disagree with the approach, but this is how we have decided to do it. Now, this does not preclude the fact that, and in fact, Finance Minister herself hinted that more will be done as deemed appropriate. And it's not just the Finance Ministry. The Reserve Bank also can, provide support through monetary means, through looking at, forbearance and so on. So there are a whole host of tools that can be used. The idea here is not to provide this grand, big package, but to roll them out in a targeted fashion so that, the difficulties that we are having currently can be dealt with as much precision as possible.
Sachin Pilot, there are those who will say that it's one thing to give cash handouts. That's one essential, urgent requirement. People need cash. We showed in the story, people are hungry. People do not have perhaps enough food at the moment. There is the other challenge, of course, of reviving the economic activity. It's come to a complete halt. Do you believe that that has to wait for the coronavirus emergency to abate? That the challenge at the moment for you and other in government is to provide basic facilities for the poor. That's your real challenge before you think about reviving economic activity?
I think that's fairly accurate. and we should have an economy left to revive. If this thing goes out of hand, who knows what the consequences will be? Of course, we can worry about the numbers and the economic impact this whole endemic will have. But far more important is to protect the population, and how we can do that is making sure that we give more disposable income at the hands of the people who are really working daily and feeding their families daily. So that is and should be the primary concern of all governments. This is beyond political biases. Those are the people, because the social unrest that this might cause if we are not able to give enough money and food to the people who need it the most is unimaginable. So social unrest is something we cannot afford to have.
Right.
I think everybody is very clear on that. But the economic consequences are not just for this country, for India. It's a global problem. So we'll figure out how to come out of that at a later stage. But right now, it's bellies to be fed, cash in the hands of the poor. People must feel secure and sure about the next meal, so that they stay on the course and see through this lockdown period.
Right.
And hopefully when the cycle breaks, we'll be able to work back and revive the economy. I'm sure it's something that everybody will wish for. But right now, the priority is to safeguard the people of India, not allow the spread of disease to happen, and make sure that the poorest among us are well fed and are able to continue to live for next 3 or 4 weeks in a manner that can be of some dignity to them.
Sanjeev, Sanyal, can we expect at some stage in the next few days a task force set up to assess the economic fallout of the coronavirus pandemic, getting perhaps some of the best minds to come together?
We are already monitoring this. There is a group of us who are monitoring the evolution, not just in India, by the way, also worldwide, on a day-to-day basis. So, there are groups of experts in various different fields. There are people in logistics looking at what is going on. There are people obviously in the health field. So this is a huge national effort being made. Believe you me, we spend a lot of time keeping track of all kinds of little pieces that are all changing almost on an hourly basis.
Right.
So yes, there is already a mechanism already in place, both at the Prime Minister's level and at the Finance Minister's level, and we will do what is necessary.
Let me ask you one final question, Mr. Pilot, because that's where we started off. The fear is that states like yours, which are states which are relatively poorer, you all were once called trapped in the Bima route trap, the so-called Bihar, Madhya Pradesh, Uttar Pradesh, Rajasthan trap, and public health has been a major concern. The quality of hospitals, the quality of public health that states like Rajasthan have. Is this going to be one of the how are you going to overcome that? How are you going to overcome the weaknesses that already exist in your public health system? We mentioned Bhilwara, that there are perhaps parts of your state that just do not have the facilities.
Well, I think there are two. One is the long-term systemic improvements that one has to do, not just in Rajasthan, but perhaps in most of the states in India. But that's, I think, a medium and a long-term view. Right now, there's enough capacity here, medical professionals, doctors, paramedics, nurses, that are, really now we're asking the people who've retired to come back and join workforce. We've cancelled leaves of people who are, in the medical profession. We've, by law, mandated the private hospitals to reserve 25% of their beds for isolation and confinement. So we're doing whatever we can on an immediate basis to meet those challenges. For example, just today I've asked the department to spray sodium hypochlorite in the villages as well. So the spray was going on in some cities in India, but now we've made sure that all the villages in Rajasthan will get that spray to disinfect, etc. So we're taking all the steps necessary given the scale of the problem. Is our healthcare system perfect? Certainly not, just like in most other states in India. We need a long-term solution to that problem. But right now, I'm very confident that with the full support of the people of the state, we'll be able to meet this challenge and come out on top.
Sachin Pilot, Sanjeev, Sanyal, all one can say is amen to that we come out hopefully stronger out of this crisis. Think about all those migrant workers and those who are living on the margins today. Thanks very much for joining me.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.